It is time now to focus on our health, and it's something that affects 20 million women, but we hardly hear about it because it's tough for some women to talk about. It is vaginal dryness. Dr. Jill is back to tackle this sensitive topic and give us some much-needed answers. Good to have you back, Dr. Jill.
Thank you.
Okay, so who's commonly affected by this? Women, of course.
Women, of course.
Which women?
A lot of women, actually. Usually, I say in the reproductive age group, it can start and go all the way to postmenopausal. And obviously, it's way more common in the postmenopausal population.
What causes this?
So vaginal dryness can occur for a number of different reasons, and that's why you really should talk to your doctor. I know it's uncomfortable and it's embarrassing, but if you get in and actually talk about it, we can give you good answers. So common reasons when you're older are that obviously you have less estrogen around, and so the body doesn't have as much lubrication around because of that. But other types of things are like just using large tampons that are too bigger than what you actually need can cause some irritation, as well as infections. So like a yeast infection can be a #1 cause. And all of this can really affect your just daily well-being, your sexual life, and you can get it taken care of.
What do you think of those kits that you can buy in the pharmacies now, where you can pretty much diagnose what's going on down there?
The pH tests?
Those tests.
I think they're valuable.
Yeah?
I really do. I think they're valuable. I would never tell you not to go in to see your doctor, because one of the things that I worry about is that if you misread it and you treat yourself, then you get into this cascade of back and forth infections,
right?
And that doesn't help. So if you can see a doctor, that's best.
So for vaginal dryness, back on our main topic here, it most commonly occurs when women hit what age?
I usually say the perimenopausal period, so anywhere from like 42 till they hit menopause, which the average is around 50, 52.
Okay, let's talk about treatment for this now.
Okay, so this is the fun part. So obviously you have to treat the cause. So if the cause of your dryness is infection, well then we need to treat your infection and that should go away.
Okay.
If the cause is that you're breastfeeding, and maybe you need a little add back therapy, one, just that you know about it will help. And then two, the use of lubrications. And then sometimes some doctors will put you on like a birth control pill that has a small dose of estrogen that won't affect the milk supply, but can bring that estrogen back to the vagina.
Okay.
And then of course, the most important ones are actual lubricants.
What about estrogen patches and things like that for women who are thinking, okay, obviously I need hormone therapy because that's what this is stemming from. What are your thoughts on that?
Okay, so that brings up a whole nother topic, because now, after they had that women's health initiative that really talked negatively about the use of estrogen, some women aren't candidates for that. And so that's where you have to talk with your doctor and say, am I a candidate for the estrogen? And if I am, that is the best thing to use, because that actually treats the problem and builds the cells back up, so it really works. But again, if you're not a candidate, then those actual topical lubricants are the best.
Okay, and any clinical pearls that you would like to share with us right now?
I actually do. A couple of things real quick. Always use water-based lubricants like the KY, Astroglide, that type of thing. Never use the petroleum-based like Vaseline. They can harbor infection and problems. And my clinical pearl is actually something we could walk over to the kitchen and find right now, which would be Crisco. Not the oil, the actual lard, and that face was exactly what every single one of my patients looks at me at. It actually absolutely works. It does not cause infection. It's cheap. It's not greasy, and it really feels nice and can really help with the problem. 2 dollops a day, 1 in the morning, 1 at night.
So use it before you need it? Is that what you're saying?
Well, use it if you need it, and then that's for women who have chronic dryness. But let's say you need it a little bit extra during intercourse. Right before, that's a great way to...
Just keep a tub of Crisco next to the bed, ladies.
It works.
You heard it from Dr. Jill, and she is the expert. Thank you so much for joining us.
Thank you.
That is a kernel of wisdom. My goodness, I never would have guessed that one. Daytime will be right back, so don't go away.